Okay, regarding the examination of the vital sign, what is removed from is the first of all, or the third one is the respiratory rate, the temperature, and lastly the pulse oximetry. In the assessment of the respiratory rate, you have to make the patient think that you are going to check his pulse while you are looking at his chest and to see how many times the chest is recoiled, and which indicates the respiratory rate, which is normally from 14 up to 18, and sometimes it is lesser than this. If the patient had the respirator for full minute, you have to check it. If the patient had lesser than this range, this is what we call it brady. If the patient had more than this range, that's to say up to more than 18 and more than 20, this is what we call it tachypnea. If the patient had lower than this range, lesser than 12, some suggest 10, we call it bradypnea. And a patient who had complete cessation of breathing, we call it apnea, and we have to know about the causes of that. After that, we have to check the temperature of the patient. Really, you have to know the normal temperature of the patient, which is 36.4 up to 37.2, and you have to know that there is daily normal variation of about 0.4 to 0.5 from early morning into the 4 or 6 p.m. and this is normal variation. And you have to know that the core body temperature, or the real actual body temperature, is the rectal temperature, which is 0.5 higher than the oral temperature, and that of the axilla or groin is about 0.5 centigrade lower than the oral temperature. Really, we have many methods or many ways in which we can measure the body temperature. First of all is the oral temperature. We have external auditory, we have the forehead, axilla, groin, or even the rectal method. And each way is chosen according to the clinical status of the patient and his age. For example, if the patient is comatose, you cannot check his oral temperature. Instead, you can use his axillary temperature, corrected axillary temperature, or even the rectal temperature. In a patient who is younger than 5 years of old, we usually choose the corrected axillary temperature, while those who are, for example, we would like to check his exact body temperature, we check his rectal body temperature. All these issues are about the body temperature. We have to put also another issue in our mind, that the body temperature, if it is increased 1 centigrade, generally there will be 10 beats increment in the pulse. Absence of this increase with the elevation of the body temperature, we call it relative bradycardia, or pulse temperature dissociation. I had many causes in the form of, for example, typhoid, brucellosis, drugs, and so on. You have to check about them. Lastly, we have to check for the pulse oximetry using pulse oximeter. This is the pulse oximeter, and I'll check the patient left index. First of all, you have to choose 2 or more than this areas, and we will see here the saturation of the oxygen. Saturation of the oxygen of our volunteer is 99. Is 99. This is the 99, and this is the pulse rate, which is 90. And then you have to check the contralateral side. Also, it is calculating now. It is also 99, and the pulse rate, this is now it is 100, and the pulse rate is 92. And we have to know that the pulse oximetry can detect hypoxia before the patient becomes cyanosis. And we have many sentences in which the pulse oximeter is not accurate. For example, if the patient had hypothermia, or severe vasoconstriction, or the patient have cardiogenic shock, hypovolemic shock, this will not be function. On the other hand, if the patient had severe tricuspid regurgitation, this device will signal the venous instead of capillary signal. Really, this device, pulse oximeter, will detect the saturation of oxygen inside the blood. The saturation, not the partial pressure or the tension. The tension or the partial pressure of oxygen is detected via a sampling from an arterial site. Really, we have additional 3 issues the candidate should know about them. is these issues are patient with methemoglobinemia. The pulse oximeter will be falsely lower than the normal. It detects the saturation of oxygen to about 85, the saturation percentage of oxygen saturation, which is not wrong, while the arterial tension, oxygen tension will be normal. A patient with carboxyhemoglobinemia, the pulse oximeter is also misleading, in which the saturation of oxygen will be higher than normal, approaches 100, while the tension of the oxygen from the arterial side will be normal. The third and the last issue is a patient with very high white blood cell count, immature cells. Those patients will have the normal saturation of oxygen, while the oxygen tension inside their blood will be low. In this state, the patient with very high white blood cell count, the saturation of oxygen via pulse oximeter will be more accurate than the blood because of the consumption of the oxygen.